Hello, everyone, and a warm welcome to another episode of the Talk Room series of podcasts, where we look at the question of how to be your best self. We do that by looking at mental health and well-being and how this applies to people's daily lives. For those people who haven't seen any of our previous podcasts, I'd like to introduce my co-presenter, Ian. Ian is a senior accredited member of the National Counselling Society and the founder of Hope Therapy and Counselling Services. This counselling practice operates throughout the south of England. So a warm welcome to you, Ian.
Thank you, Wendy. And to introduce you, Wendy is a highly experienced CBT psychotherapist working in private practice and has been involved in the field of mental health more generally for well over 30 years. So a pleasure to be here once again with you, Wendy.
And with you, Ian. Thank you very much. So today we're here to delve into a topic that affects countless relationships worldwide, the impact of mental health challenges. Mental health isn't something that only concerns us individuals. It's an issue that profoundly influences the dynamics and well-beings of couples. Recognizing that mental health challenges, they just don't discriminate. It's crucial. They can affect anyone, regardless of your age, gender, background, or educational status. So whether you've recently met, recently married, or a pair who've been together for decades, or anywhere in between, you're not alone if you're facing this challenge. So, Ian, I know your counselling agency, Hope Therapy and Counselling Services, does a huge amount of relationship counselling, both one-to-one and for couples. So I wonder if you'd like to say anything more before we get going.
Yeah, thank you, Wendy. So, as you say, mental health can affect absolutely anyone. And as a result of that, can impact even the strongest of relationship in a whole variety of different ways. So today we're going to explore how those challenges can manifest in relationships, affecting everything from communication through to intimacy and the daily interactions that can shape people's connection. But let's just start for a moment by looking at the slightly broader picture. So research very clearly shows that mental health issues are more common than many people realize. So in any given year, approximately 1 in 4 people in the UK will experience some form of mental illness. So given that prevalence, it's more than likely that at least one partner in a relationship will encounter mental health challenges at some point. But mental health doesn't just manifest as a clinical diagnosis. It encompasses a whole wide range of experiences from stress and anxiety to depression, in addition to a vast number of additional presentations as well. Each of those challenges has unique effects on both individuals as well as their partners as well.
Yes, Ian, that is so absolutely right. I mean, it's often said that awareness is the first step towards any kind of change. And when it comes to mental health, awareness can be a crucial factor in maintaining a healthy relationship. So how about we start by exploring the signs and symptoms that both you or your partner should be aware of?
So first and foremost, just paying attention to changes in your partner's behavior or their emotional state can be really essential. All the more so if you know there's been a history of some sort of instability with somebody's mental health state in the past. So people may exhibit a variety of different signs depending on the way that the mental health challenge presents itself. But we might be looking for things like increased irritability, an increased level of sadness or mood swings. You might notice they withdraw from activities that maybe once they enjoyed, or they have difficulty concentrating on things. Changes in sleep patterns can be another indicator for some people. Are they struggling with insomnia, or maybe they're oversleeping? Both can be signs that there's some sort of underlying issue that's becoming present.
Mm-hmm.
Appetite changes too can be a really significant signal. A decrease or an increase in eating habits can suggest emotional distress in one form or another. Sometimes mental health challenges can manifest in physical symptoms as well, such as unexplained aches and pains, headaches, digestive issues. They can all be signs of stress or anxiety.
Okay.
We may notice communication patterns have started to change. So, are they expressing feelings of hopelessness or worthlessness? Are they withdrawing from conversations, or frequently mentioning feelings of anxiety or feelings of fear about things? Again, these can all be signs that there's some form of underlying issue starting to manifest. We might notice that there's changes in energy levels. So, are they excessively fatigued or restless? Do they seem to have trouble getting out of bed in the morning or settling down at bedtime? Again, the research tells us that there can be a really significant link between mental health and sleep patterns. So those are all things to look out for. We may notice changes in terms of social interactions. Are they avoiding social events or neglecting friendships that they might have? And isolation is often a sign that something may be amiss for people.
Okay.
But we also need to remember that the presence of any one of those signs on their own doesn't necessarily automatically indicate that there's a mental health issue. It's essential to really approach the topic with a degree of sensitivity and a degree of empathy. Your partner might be dealing with stress, life changes, or other factors that can be impacting their mood or impacting their behavior. So it's important that when we have a concern about something, that we address those things within a spirit of inquiry, within the spirit of support, rather than simply trying to diagnose somebody.
Mm. Okay, and yes, that's really interesting. The gentleness of inquiry. What I think you're saying is, rather than simply diving in with a diagnosis, that seems really important. I wonder, could you tell us a little bit more about that?
Yeah, of course. So it's important to try to encourage a sense of open, non-judgmental communication. So asking partners how they're feeling, and let them know you're there to support them and to listen to them. Understanding and support can make a significant difference, both in terms of preventing a mental health issue from escalating, as well as helping someone become ready to reach out for support if they are struggling with something. And if you've observed those types of signs or signals in a partner, just considering suggesting that they talk about it, maybe reaching out to a counsellor. And that can be really well received sometimes, especially if somebody's already familiar with the counselling process. Maybe they've experienced counselling in the past, or they know other people. But just presenting that as an option to people can be really, really helpful. Reaching out for help or suggesting it can be a courageous step sometimes, but it can also really lead to improved mental health and relationship well-being more generally as well. So if we notice those changes in our partners, it's important I think also to just stop and reflect on our own mental health. Are we experiencing changes in our emotional state, in our behaviors? Because sometimes partners can be going through challenging times simultaneously, and recognizing those things within ourselves as well as our partners is actually a really, really important step within a relationship.
Mm. Okay, thank you for that, Ian. So I'm wondering, let's say that people have noticed that slippage and they know there is a need to take some sort of step. So, is there anything they should be thinking about before reaching out for support, or maybe at the same time as reaching out?
Oh, yeah, a really, really excellent question. So I would say that one of the things that couples in any healthy relationship should be doing is just practicing self-care. So whether things are ticking along just fine and you simply want to keep it that way, or whether you've noticed that there's some degree of slippage and want to get on top of things, or you or your partner are really struggling and have either reached out or in the process of thinking about reaching out, that self-care is really important. So in each of those cases, I would say just managing self-care and being aware of the importance of self-care is really, really crucial. It's vital to maintaining your well-being. And it's also really vital in terms of fostering a healthy relationship with our partners as well. And self-care starts with taking care of your own mental and emotional health. When you're dealing with a partner's mental health challenges, it's easy to neglect your own needs, but remembering that you must be well yourself before you can offer support to your partner. And there's a whole variety of things that we can do to support ourselves. And I'll give a few examples. And there's no suggestion that we need to be doing all of these things. The important thing really is just identifying things that feel as though you can connect with those things. So we might think about things like mindfulness practice or relaxation practices.
Mhm.
So incorporating mindfulness and relaxation techniques into our daily routine. Practices like meditation, deep breathing exercises, Pilates, yoga can really help reduce stress and improve overall emotional well-being.
Mhm.
We might think about things like exercise. So physical activity, really essential for maintaining physical health, but also in terms of boosting your mood and can be really helpful in terms of reducing anxiety as well. So considering engaging in regular activity, we don't need to be going off to the gym every day, but thinking about activities that we can either do solo or as a couple. So that might be going for a walk together. That might be doing a Pilates video or watching a YouTube exercise clip, might be going out in the garden and doing some gardening together. So just picking a thing that we can either do individually or we can do as a couple, and just something that has meaning to you and that you feel that you can connect with. Hobbies and interests. So engaging in hobbies and activities that bring you a sense of joy, a sense of fulfillment, both individually and again as a couple as well. So pursuing your interests can be a form of really important self-care, and sharing those activities with our partners can strengthen the bond that we have with our partners as well.
Mm.
So as well as individual self-care, there's also self-care routines that couples can consider too. So that might be things like just spending quality time together, doing things that strengthen the connection and bring you happiness. That might be things like a date night. It might be things like going for a walk together. those sense of shared experiences, they can all help maintain the vibrancy that exists within a relationship.
Again, Ian, that is really, really helpful. Thank you for that. And this idea of general self-care, both for individuals and for couples, it just sounds really, really beneficial. But I wonder if other coping strategies might also be beneficial to think about. Do you have any suggestions there, Ian?
Absolutely. So several things can be beneficial. Some things that you can work on independently of a counsellor, whereas other things, a really good counsellor with appropriate experience can be an excellent resource to help you support looking at certain things. So we might think about things like building general resiliency. So resiliency is adapting to adversity and overcoming life's challenges. It's a really important, really valuable skill for individuals, but also for couples as well. So building resilience together can help us face mental health challenges with a sense of strength and with a sense of determination. And an experienced counsellor will absolutely be able to support you individually or as a couple in terms of looking at those types of things. Understanding the condition. Well, education can be a really important thing. So learning about your partner's mental health condition, its treatment options, its triggers, understanding the condition can reduce misunderstandings and can just help you provide more effective support within the relationship as well. And again, an experienced counsellor can certainly help you to look at that. Creating a supportive environment within the home can be really important as well. Our home should be a safe and supportive space. So ensuring it's a place where both partners feel comfortable discussing things, discussing feelings, and seeking help where needed. So trying to minimize the stresses and conflicts where possible. And that can be challenging, but again, that's a piece of work that an experienced counsellor can absolutely do with people. And then we might think about things like shared decision making. So making decisions together, particularly those related to treatment plans or seeking professional help. So collaborative decision making can help both partners feel empowered and included within the process. And then we might talk about things like more general stress management. So developing stress managing techniques. Coping with mental health challenges can be really stressful, both for the individual, but also for the couple as well. So learning to manage stress can lead to a more peaceful and a more harmonious relationship. And then just more generally seeking professional guidance. So, being able to consult with a mental health professional, a counsellor, a therapist for guidance, and counsellors and therapists, if we pick people with the right experience, can really support us in terms of identifying strategies that can support both individuals and couples. Maybe things that you haven't considered in the past. They can be really valuable in just giving us a slightly different perspective, an outside perspective. And then establishing boundaries. So healthy boundaries, both for us as individuals, but also for relationships and couples, are absolutely essential. So talking openly about what each partner needs to feel emotionally safe and emotionally respected, and respecting the boundaries of our partners, and being able to feel that we can expect the same from our partner as well. So I think that's just a few of the things that I would say we can think of, some of which we can work on individually, but but certainly an experienced counsellor or therapist can support us in terms of looking at those things.
Okay, thank you for that. Great answer, Ian. Great answer. So, if we could now just talk a little bit more about what to do if we notice there's some form of mental health challenge there. Perhaps people have worked hard at managing their self-care, but they still feel they would benefit from reaching out from support. What can people do then?
Yeah, of course. So many couples may find it difficult to take that step together. Still, where people do, it can be an absolutely pivotal moment in their overall journey to well-being and a healthier relationship together. So what I would say is, if you've noticed signs, if you've noticed symptoms of mental health challenges in yourself or your or your partner, the idea of seeking professional help, whereas it might feel daunting, there really are lots and lots of benefits of doing so. And one avenue of support that people can get is couples therapy, also known as couples counselling or sometimes marriage counselling. Although, to be really clear, you don't have to be married to reach out for that type of support. Um, and that type of therapy, it can often focus on improving communication, understanding, problem solving within relationships. So it really can look at a wide range of things that can be really helpful. And when facing some form of mental health challenge, an experienced couples therapist can provide several benefits that can really benefit both partners. So it can help us just consider things like a safe space. So couples therapy offers a safe and non-judgmental environment to discuss feelings, concerns, struggles. So during a period when one or possibly both partners are struggling with mental health challenges, both partners are likely to be impacted. So both may often benefit from an opportunity to discuss things together in a non-judgmental, in an open way, with somebody that can hold that space.
Mhm.
Can help us look at how we can improve communication. So again, skilled therapists can help facilitate healthy and constructive communication between partners, helping to break down some of the barriers that may exist, help us to look at some of the misunderstandings that may have built up over a period of time. So again, couples counsellors have significant experience in working with mental health, or certainly picking somebody that does. So just checking the knowledge out of your therapist can be really important. As I say, many can have, and it's just important before you make that selection of who you're going to work with that you just ask the question, what's their experience of working with mental health? We might think about understanding and empathy. So again, therapy can provide a deeper understanding of each other's perspectives, and just foster a sense of empathy for the challenges that both partners are facing. So when we're immersed in a problem, it can sometimes be really, really challenging for us to separate the person from the problem. And a trained counselor can just help us find a little bit of perspective regarding that. They can provide practical tools, practical strategies for managing mental health issues within relationships, and just helping couples cope more effectively. They can also help us look at things like conflict resolution as well. They might look at conflict resolution techniques, which can be really, really helpful in terms of addressing some of the challenges or some of the disputes that might be building up with the relationship. So there is really a lot to be thought about as regards to that.
Mm. And Ian, you described so many benefits, and it sounds amazing going to a couples counselor to receive all that support for your relationship. But I'm just wondering that some people may still think there's a stigma about reaching out for support for something like this. Could you tell us a little bit more about that, Ian?
Yeah, of course. So, and I think that's an absolutely excellent point. You're right. For some people, especially if they're not used to the idea of counselling, they can wonder what it's all about. They can wonder what the implications of needing a counsellor might mean. So, firstly, it's important to remember that seeking help doesn't necessarily mean your relationship is failing in some way. In fact, it can be quite the opposite. It demonstrates a commitment to the relationship, and it can really demonstrate a commitment to the well-being of your partner and to the relationship more generally. It can be a courageous step towards a much better future together. And it really can be a commitment that we make to one another. But I think the other thing to remember is that counselling is completely confidential as well. So your next door neighbour won't know, your work colleagues won't know, your family members won't know. The only people that know are the people that you choose to share it with. So there is a complete privacy as regards to this process as well.
So thank you so much. That's really helpful, Ian. Thank you so much. Um, so I hope the insights shared in this particular episode have provided guidance and inspiration to listeners as they navigate their journeys. It certainly provided inspiration for me. So thank you for that, Ian. So if people do decide that they want or they need further support, can you say a little bit more about what they can do about that?
Well, Hope Therapy and counselling services are a whole team of relationship counsellors. We can work both one-to-one with individuals, but also with couples as well. We've people within the team who have experience working with everything that we've discussed in today's podcast. So people are very, very welcome to reach out to us and we can discuss next steps with them. But people are also welcome to take a look on the website as well, www.hopeforminds.co.uk. And if you then just go to the services option, there's an option for relationship counselling, and we give a whole raft of information. And there's various resources, blogs and infographics and a whole variety of things, all of which are completely free of charge. So take a look at the website, and if it's helpful to you, just get in touch, and we're more than happy to have a completely free of charge conversation with people. But also you, Wendy, you're hugely experienced psychotherapist, and you work with mental health the whole time. So maybe just telling people a little bit about yourself and what you can offer, just to help people understand that as well.
Absolutely. So, yes, I specifically work in mental health services, so anxiety, depression, trauma, self-esteem, things like that. But often people come to me with a range of problems, and often relationship problems are very common. So, as part of the package, I can help to see people cope with problems in their relationships, or I can have people attend sessions with the person who's experiencing the mental health problems, or I can see couples together, more like a couple therapy type of thing. So if anybody wants to know more information about what I do, my website is wendycastellino.com, and just drop me a line, and I look forward to, if anyone wants to have a free consultation, they're very welcome to contact me there, and I've got resources on my website as well. So Ian, it's been a delight talking to you, and a really important subject, actually. I think it's so important, and maybe not spoken about as much as it needs to. So thank you so much for all that information. Really, really useful. And then we're going to move on to our next podcast, which is all about a particular skill this time, about visualization techniques. So thank you everyone for listening. We really appreciate you coming along and listening to us. And thank you, Ian, for all the input that you have given.
Thank you, Wendy.
Okay.